Okay, I'm Jalen. I'm from the Pharmacy 2 class. Well, we all are, but it's kind of...
I'm Evan. Oh, sorry.
Sorry, that's my fault. If you want us to use the microphone, please let us know. Because I am louder than they probably are. If you feel like you can't hear, please let us know. Okay, Evan, I'm sorry for interrupting.
I don't forgive you. I'm Evan.
I'm Whitney.
I'm sorry. All four are in my Pharmacy 2 class, along with our special guests. Would you guys like to introduce yourselves? They're from the Virginia Tech Neuroscience department. They are what year?
I'm a sophomore.
Sophomore?
I'm a junior.
The juniors. So they, along with my students and their professors, have worked to revamp this presentation. And I'm going to let Jalen kind of give you guys a quick one of your name.
I'm Charlotte. I'm Bella.
Okay. So we've been working with them for quite some time on this.
Yeah. Ready?
Go for it.
Okay. Welcome to the Dangers of Fentanyl presentation. The original presentation by Virginia Foundations for Healthy Youth, adapted by Virginia Tech School of Neuroscience team, and presented by Pulaski County High School pharmacy students. We have spent the last 3 months working along with New River Valley Regional Commission and Virginia Tech School of Neuroscience to develop the most updated information on the hot topic fentanyl, also known as Duragesic. So the difference is fentanyl is like Kraft mac and cheese, and Duragesic is like the Walmart brand mac and cheese, if that makes any more sense for y'all.
It's like the generic version.
Yes.
I love it.
So a little disclosure, this presentation addresses the fentanyl crisis and its impact on public health. The following content includes data and descriptions regarding substance use and overdose that may be distressing. We encourage you to engage with this information as a tool for safety and prevention, but please prioritize your well-being. If you feel that you need to step away on the content, please let faculty or staff know. Not a big deal if you feel like you need to step away and it's too much. What we're going to go over is going to include what is fentanyl. This is just our learning goals. Why is fentanyl dangerous? How do opioids? And opioids is a hard word for me, and I have to say it like 25 more times. Forgive me. But how it affects the brain and body. How do you respond to the opioid overdose? Opioid overdose, and identify resources for support and harm reduction strategies. I'm going to give it to Evan.
Thank you. Now, thank you. What is fentanyl? You probably heard the name, but technically it's a synthetic opioid. Synthetic just means that it isn't grown in a field like a poppy. It's engineered in a lab by scientists. Because it's man-made, it can be designed to be incredibly concentrated and effective at very tiny doses. Why it's dangerous? To give you an idea of its power, it's about 50 to 100 times stronger than morphine and about 50 times more potent than heroin. In a medical setting, that's useful for extreme pain, but on the street, that's a different story. There are 2 different types of fentanyl. There is pharmaceutical fentanyl, and there's illicitly manufactured fentanyl, or IMF. Pharmaceutical fentanyl is legal. It's prescribed by a doctor for things like advanced cancer pain, and it's highly regulated and measured. Illicitly manufactured fentanyl is the one we're worried about. It's made in illegal labs. Why is fentanyl a problem? For one, it's being mixed into things like weed, vapes, and other drugs. You usually can't see it, smell it, or taste it. Fake pills look exactly like ones from a pharmacy. If it came from a friend or a dealer, it's probably fake. A lethal dose is tiny, about the size of 2 grams of salt or the tip of a pencil. Oh.
Yeah.
Okay. Most people don't overdose on purpose. They are poisoned by a drug they don't even know they took. Pharmaceutical fentanyl versus illicitly manufactured fentanyl. Pharmaceutical fentanyl is a real medicine used by doctors for surgery and extreme pain. It's controlled and safe, and in a hospital, so yeah. Almost all overdoses come from illicitly manufactured fentanyl. This is the stuff made in illegal labs and not by doctors. Dealers use IMF because it's a cheap way to make their product more addictive. It's not about the medicine, it's about making a profit by secretly hooking the user. Whose turn is it?
Me.
There you go.
So why is fentanyl dangerous? For the younger population, fentanyl is the leading cause of death over suicide and COVID. This almost doubles motor vehicle accidents, suicide, and COVID. These factors all emphasize the importance of learning more about fentanyl and what it can do to your body. This graph shows nationwide overdose involving opioids and other drugs over a 10-year span. There was a rise in deaths until around the end of 2023, and then there was a sharp decrease in deaths in 2024 for several reasons, including increased funding and emphasis in prevention and education programs, widespread distribution of naloxone. This shows the importance of programs such as these and the purpose as to why we deserve to learn about fentanyl and how it might affect you or someone you know. This graph is only showing deaths, not the total number of overdoses or people affected. Overdose trends are similar among individuals around 15 to 24 years old. This image describes the potency of common opioids. Potency refers to the strength of a drug. In other words, how much of the drug is needed to produce an effect. How do I say that? Carfentanil, which is 100 times stronger than fentanyl, is used to anesthesize, which is paralyze, large animals like elephants and rhinos. It is derived from fentanyl by altering a few molecules. Synthetic drugs can gain incredible strength, making them even more deadly.
I was giving the mic.
Oh, are you serious?
Yes, too much.
Fentanyl is commonly mixed with drugs like heroin, cocaine, and methamphetamine, and marijuana, and made into a fake or counterfeit pills that are made to resemble prescription pills. With the amount being so small, it can be undetectable when mixed with other substances. Fentanyl is so strong that it is difficult to mix evenly. This means that one pill can have little or no fentanyl, but another pill from the same batch could have a fatal dose of fentanyl. Is my pictures? It's your picture. Sorry. No, you're fine.
Just say.
Okay, so what I'm gonna do is we're gonna pause for a second. And I'm gonna bag you. I want you guys to pass the baggie around. Look at the baggie. That right there is showing you a lethal dose of fentanyl. This is salt. Do not think that this is
Oh, I was like, there ain't nothing in that bag.
It might be a little hard to see, but what you see in your bag could kill, if it was fentanyl, it's not, but it could kill 2 to 5 people is what in that bag.
We put a little bit more than the actual lethal dose for one human because it was hard to see 2 grains of salt. So when you look at that, that is essentially enough to kill 3 to 5 people.
Oh my God.
You already read that part?
No. Do you want me
I'll
to?
wait. Give them. What was the question, John?
Is that actually how small it is?
Yes, very, very accurate.
Do you want
Okay, yes, go ahead.
Yeah.
The picture on the right is a lethal dose of fentanyl. Even a small amount of fentanyl is sufficient to be lethal, and it can be found in many common substances. Where is fentanyl commonly found? You want me to ask them, or?
Yeah.
Where do you guys think you can commonly see fentanyl? How do you think you can come into contact with it?
Any guesses are welcome.
Yeah, just.
Worst thing that could happen is you're wrong, but that's okay.
Mixed together by other compounds?
Like, what do you think it would be mixed in, John? What do you think you could have that it would be mixed in?
Signal.
They
Got a microphone on.
Most common ones that you guys potentially could see them.
Nobody can hear me.
Weed.
Somebody said weed?
Mm-hmm.
Yeah, good guesses. Were you raising your hand, Caleb? Any type of drug. Victoria said any type of drug.
Yeah.
Okay, so we're gonna go to the next slide for that. Do it.
Is it Surrey? Because I'm on.
John asked if it was alcohol part of it.
Essentially, John, I mean, it does absorb into
That's what
liquid,
the
so it could be something that's dropped into,
I'm confused.
that could be dropped into a drink and dissolve, absolutely.
I just gotta
Probably not
find
most
that
commonly
button.
found that way, but that is an option. No, still you.
Okay.
Which one are you on, the counterfeit?
Am I good?
Yes, you're good.
Counterfeit pills are deadly. The current number of counterfeit pills that are deadly are 5 out of 10. 50% is a huge chance that a drug is counterfeit. There are many factors that determine whether a dose is deadly or not, including someone's age, health, or if they have a tolerance to opioids. People with little or no history of opioid misuse or who used to misuse opioids but have not used them in a while are most likely to overdose, as they have no tolerance to the drug. If pills are obtained off the street or on the internet, the chances are very high that the pills are fake. Pressed pills are made in a way that does not create uniform distribution. So some of the pills in a batch may have no fentanyl while others have a high, potentially deadly amount. No one is regulating the production of these illegal pills. Not sorry.
Not yet.
You're so bored. I'm 22.
Clone pills. These fake pills look exactly like real Oxys, Perks, and Xanax or Adderall. You cannot tell the difference just by looking at them. They are sold right on Snapchat, TikTok, and Instagram. It's as easy as ordering a pizza, which makes it feel safer than it actually is. Because they look like medicine and are sold on apps, it's easy to forget you're taking a massive risk.
I felt really stupid when I heard it could be bought on Snapchat. I had no idea that
That's
social
why I just
media
made that
platforms
face.
you can buy off of them when we were doing this.
So I want you guys to raise your hand if you think the one that says 80 is the real one. So raise your hand if you think 80 is the real one.
Oh.
Okay? Now raise your hand if you think the one that says OC is the real one.
So guess what? We have no idea. We have no idea which one's real because we have a slide that actually does. So that goes to tell you right there. You really don't know.
You're doing great, Whitney.
You already answered that.
Yeah. I mean, from working in a pharmacy, I feel like drugs most of the time will say a number, but
Just say,
no matter what, like we
where
have
would you
no
come
idea.
across? These are some of the places that you can find it.
Okay, you stay. Okay.
So after we talked and you guys all had a couple ideas as to where fentanyl is formed, this kind of just gives you an idea. It could be, at a party. It could be at a festival, a concert. Essentially, these vapes that you guys, vapes are a big thing right now. It's easily accessed to those. Okay.
Fentanyl taken by the DEA. The DEA seized enough fentanyl in 1 year in the U.S. to kill every single man, woman, and child in the entire country. The chances are very high that pills being obtained from anywhere but a pharmacy or hospital are fake. It is not worth the risk that goes with them. In addition to pills, fentanyl powder is being mixed with drugs like heroin, cocaine, methamphetamine, and even marijuana, and causing fatal overdoses to unsuspecting users. In its liquid form, fentanyl can be found in nasal sprays, eye drops, and dropped onto paper or small candies.
Okay, so here is the real question. Raise your hand. This is oxycodone. Oxycodone is an opioid. It is used for pain. On the right is Xanax bars. These are used as a benzodiazepine. They are used for anxiety. How many of you think, now we do know that we know which ones are fake and real in this one. So how many of you think A in both pictures are real? Caleb and Erica and Haley. That's the only people that think they're real. Okay, so everybody else thinks that B is real?
Yeah, raise your hand if you think B is real.
Raise a hand if you're scared to answer. That's no different if you actually end up in a situation where you have the option to take a pill. It's hesitant. Now, which one's right?
Choice B is the correct answer.
Yeah,
Choice
so
B
y'all are
is the
good at
correct
this. Y'all should all
answer.
take Miss Bird's pharmacy class because, I mean, I had no idea the first time I looked at it.
Okay.
What is rainbow fentanyl? Most legally manufactured medications are not brightly colored. This could be a sign that the pills are fake.
So just know, if you see an assortment of, another thing that we didn't talk about in the first session that I was introduced to in a topic of conversation, a Skittles party. Has anybody ever heard of a Skittles party? Real Skittles? John, have you heard of a Skittles party? Okay, so a Skittles party is essentially where you show up at a party and you come with a bottle of pills and everybody throws them into the same bowl. And then you take a pick. Okay? That in itself would look something like this. We should not, none of us should want to take behind that. Okay. Can we do this part?
I can do it.
Okay, give that to Jalen. And Evan, will you give your mic to Jalen, please?
I didn't know I had it.
It's right here for you.
Alright.
And then y'all have Dawn hop down and we're gonna pass these out after
Right
she
now?
reads
Yeah.
the first
Okay.
section.
So imagine making a batch of chocolate chip cookies.
It's not-
You mix the chips in the dough, but the chips don't spread out perfectly. When you bake them, one cookie might have 2 chips while the other has 15. In illegal labs, fentanyl is the chocolate chips. Because it isn't mixed by professional chemists, one pill might be harmless, and the next one could have a clump of fentanyl or a hot spot. Just because your friend took one and was fine doesn't mean yours is safe. You're betting your life that your pill isn't the one with the extra chips. We actually made you some chocolate chip cookies today. So we're going to pass those out right now.
Evan, you
Do you want
grab a
to-
handful and bring them to this side so you can.
Here, which side are you on? Oh. Oh. Okay.
So we're going to explain what to do with them, so don't open them quite yet.
You can pass these down there.
No, there's not fentanyl in them. Don't worry. Yeah, no. Yeah.
Then you can pass those. Whitney, we're starting it like that. I think that should be enough. There's 3. Is that enough for everybody? Okay. Pass those. I don't. What?
Did you open the bag, Hunter? Yeah, follow the rules, buddy. Yeah.
Alrighty then. I don't know one. Did they all get one?
I don't.
Okay.
Yeah, raise your hand if you don't have one. Everybody has one? Okay. No. So. Okay, everybody take your cookie out.
That was a lot of fun.
You're looking at it, they all look pretty similar, right? They're all just chocolate chip cookies. We baked them yesterday. Okay, they all look pretty similar. Okay, now I want you to break it in half. And then,
Do y'all need one?
that's okay, it's even better. So I want you to count the chocolate chips you can see on each side. Okay, and then raise your hand if they're the same. Raise your hand if they're not equal. Yeah. So, where was my point with that? Oh, yeah, so you see how the chocolate chips aren't spread out evenly? It's the same thing with IMF pills or illicitly manufactured pills. So we are going to eat these because they don't have fentanyl. But with street pills, you're never going to see the ingredient list. You'll just have to hope that you don't pick the hot spot. So, is this one mine?
Sorry, she's one this guy. Is it up high enough for you to see?
I think so, yeah.
Okay, bring it back up here. Now you're going to learn the chemical effects of, once you take it, what does it do to your body, okay?
Okay, so this is how do opioids affect the body. Opioids are like a mute button for your nervous system. They slow down every signal your brain sends to your body, many of which you can see on this slide. At first, it feels like a total relaxation or a high, euphoria. It kills pain, which is why doctors use it for surgery. But your body also reacts in gross ways. It can make you feel sick, throw up, or cause major stomach issues like constipation. The lethal part is respiratory depression, because your nervous system is muted and then your brain literally forgets to tell your lungs to breathe. You don't just fall asleep, you stop breathing, and with fentanyl, that slowdown happens so fast you can't fight it.
How many of you realize that your brain tells your lungs to breathe? Some of y'all that are back there, we've talked about it in my class. So when you take a drug like that, that's what it essentially does. It tells your brain, hey, this feels good, and then it slows down everything else. It slows that breathing down. And then that's where we end up in a deeper conversation. Okay.
And then how do opioids cause pain relief? Your brain and spine are covered in landing pads called receptors. These are designed for your body's natural feel-good chemicals like endorphins, the rush that you get from an exercise or laughter. Opioids look exactly like your natural chemicals, so they land on those same pads, but they're way more powerful. They basically hijack the system. Once they land, they cut off the pain signals. It's like a radio station losing its signal. The pain is still there, but your brain can't hear it anymore. They don't just stop the pain, they change how you feel about it. Your brain stops caring that it hurts and focuses only on the high that you get. Your brain releases dopamine when you do something good, like eating a good meal, winning a game, or even getting a like on a post. Dopamine isn't just a happy feeling, it's a do that thing signal. It's your brain's way of saying, this is important for survival. Remember how we did this. Opioids don't just tap the dopamine button, they smash it. They flood your brain with way more dopamine than any natural activity ever could. After a while, your brain gets confused. It starts thinking the drug is more important than food or sleep. It rewires your survival instincts until the only thing that feels important is finding the next dose. Opioids plug into your brain receptors like a charger into a phone. This releases a massive flood of dopamine. It's like a hack. You get a huge reward without actually doing anything good for yourself. Your brain isn't used to that much power. To protect itself, it starts to turn down the volume on those receptors. Now, normal things like your favorite food, a funny video, or hanging with friends, feeling boring or weak, your brain is so used to the hack that it forgets how to enjoy real life. Because the drug is doing all the work, your brain stops making its own natural dopamine. Without the drug, you feel like a phone on 1% battery, exhausted, depressed, and physically sick. You aren't using the drug to get high anymore. You're using it just to feel normal and to get out of bed. People think building a tolerance is like building muscle, that they're getting stronger against the drug. It's the opposite. Your brain is actually becoming less sensitive. You keep raising the dose to feel anything at all. There is a ceiling to what the human body can handle. Eventually, the dose you need to feel normal becomes the same amount that is lethal. You end up chasing a feeling that your body literally cannot survive. The gap between feeling okay and dying disappears.
So what do you guys think what does it feel like to have an opioid in your body? After she just described to you what the chemical does once you take that drug, what do you think your feelings will feel like? Victoria, you're always good at answering help.
Say calmer.
Yeah, like once they take the drug, you start to feel like
Relax. Is that the word you're looking for, John?
Mm-hmm.
You feel relaxed, and also it's like a pain reliever, so like any after physical pain can be released.
And it feels good, right? Because that pain's not there.
Mm-hmm.
Okay.
You got one over there. There.
Do what?
Raises his hand.
So that, you know what, that's a really good statement, because that's why we keep going back for it, because how many of you like energy drinks? Raise your hand, because I know my whole entire class should raise theirs. Yes. Okay. Okay. Okay, John. Let me give you, step back there after I finish this, and then I'll give you a pass. How many of you like, I said y'all energy drinks. How many of you like,
Do I need to read that?
what is another thing that all y'all like?
Sugar.
Just sugar in general. How many like chocolate? How many
Or
like
coffee.
That is a need that if you don't have it after a period of time, your
a little
body
bit
starts doing that thing where you get a headache, and you shut down and crash. The same thing. So your statement was a great statement because that's what you want. You want it again because then you know what that feeling feels like. So you kind of have to go back.
Do I
Okay.
need to read these? Like, what it is or?
Yes, you can give it. So give those
Okay.
examples.
So essentially what you would feel like is you would feel warm and numb, you would have intense sleepiness, you'd have tiny pinpoint pupils, itchy skin and nausea, and slow, shallow breathing. When withdrawal begins, your body is freaking out because it's a manual override, which is the drug is gone. It feels like the worst flu ever, shaking, sweating, and vomiting. Since the drug blocked the pain for so long, now everything hurts twice as much. You feel intense anxiety and cravings that make you feel like you'll die without it. Most people keep using just to stop the pain of withdrawal, not even to get high anymore. The addictive nature of opioids is a brain disorder, not a choice. The drug physically rewires how your brain works. No one knows their addiction score. You can't predict if your brain will get hooked after one dose. If you're prescribed opioids in high school, you are 33% more likely to misuse them later. Your brain is still developing as a teen and more vulnerable. It only takes 4 to 5 days for your body to start wanting the drug regularly. Dependence starts way faster than people think. And I know when we went over this, they wanted to really emphasize that it is a brain disorder, not a choice.
Yeah, it's a brain disorder, guys. So once you find that piece of liking, your body keeps wanting it. Okay, it's not always a choice. That's what you have to remember. Okay.
Evan, do you need the mic? Mic.
What is an opioid overdose?
You might need the mic.
He needs the mic.
No.
I'll hold it.
Your brain uses the same control panel for pain and breathing. It is called the medulla oblongata. They are right next to each other. When opioids quiet down the pain, they don't know how to stop it. They quiet down the breathing signals too. This is why an overdose happens. It's not that your lungs stop working, it's that your brain forgets to tell them to move.
So if you take anything away from this, we told you just a few minutes ago that our brain tells our lungs to breathe. But what he's telling you now is that after you've taken that drug and you've hit that overdose, now your brain no longer knows to actually do that. I mean, your lungs no longer know how to do that because your brain is not telling it to.
Yeah. So how do you respond to an overdose? The signs of an overdose would be the blue symptoms, which are right here. You can probably do the images now too. It stands for, blue, lips, unresponsive, and eyes. If a person is discovered with the following symptoms, it is vital that you call 911 immediately. Not everyone will have the same symptoms. An overdose very commonly looks like someone is sleeping. There's about a 5-minute window to revive somebody from an overdose if they've stopped breathing before the risk of damage to the brain begins due to lack of oxygen. During that time would be the optimal time to administer Narcan, which we will talk about later more. We will actually talk a decent bit later about Narcan. So, first response, call 911. Don't wait. Don't try to wake them up with a little bit of cold water or hit them or whatever. Call 911 immediately. Use Narcan. If you have it, use it. It's a nasal spray that acts like a power reset for the brain, kicking the opioids off the receptors so the person can breathe again. Lay them on their side, which also is very important so they don't if they do throw up, so they don't throw up and choke on it and again stop breathing, because that's what we're trying to prevent. This keeps their airway open to prevent them from choking or get sick. Narcan is a temporary fix. It's like a 30-minute Band-Aid. Once it wears off, the person can slip back into an overdose, so they must go to the hospital. During this time, if help is not there, you are able to administer Narcan with no harmful effects. So Narcan can wear off within 30 minutes, like I said. So it is perfectly okay to administer it again, because depending on how much fentanyl they took, they can slip back into an overdose, and they might need a second administration of Narcan, which it won't affect them at all. So in Virginia, we have the Good Samaritan law. In Virginia, if you call 911 because someone is overdosing, you are protected from being arrested or charged from the drug possession. So if you and your buddy are, I don't know what you and your buddy are doing, but your buddy goes into an overdose, but you were both taking the same drug, and you don't want to call 911 because you don't want to get in trouble. Virginia protects you from that. If your buddy goes into an overdose, but you are also doing the same drug, you cannot get in trouble for it because the law cares more about saving a life than making an arrest, like arresting you. They want to save your buddy. Don't leave your friend behind because you're scared of the police. The law is on your side, so you can stay and help. So, we're going to talk about naloxone or Narcan. You can walk into any pharmacy and buy Narcan over the counter. It comes with 2 doses per box. If they aren't overdosing and you give it to them anyways, nothing happens. It only works if opioids are in their system. When in doubt, use it. Because fentanyl is so strong, one spray might not be enough. If they don't wake up, give them a second spray in the other nostril after like 2 to 3 minutes. A preventative action includes fentanyl test strips that can check the pill or powder if it has fentanyl in it. They aren't 100% perfect. A negative result doesn't always mean 100% safe. It might miss super fentanyls like carfentanil, which we talked about in like the first 5 slides. It's the one that's like either 50 times or 500 times stronger, the ones that like knock out an elephant. So it might not catch that, which could be fatal. Remember the cookie theory? You might test one corner of the pill that's clean, while the deadly clump is on the other side. So the test strips are beside the Narcan on the bottom, but that's just what Narcan looks like. So if you were to get it.
You can get it at like any Walmart, Target, any kind of drugstore, but also our health centers, our health departments actually have them on property for you as well. If you are a patient that is receiving like a knee replacement, a rotator cuff replacement, and you have to get pain pills, or for a lot of you, you guys get your wisdom teeth removed, and they will give you oxycodone for that pain. Essentially, they also give you a prescription for Narcan to have that filled, because if you're hurting and you take that one pill and you don't realize that it says every 4 to 6 hours, and in 2 hours you pop another one, and 2 hours from that you pop another one because you just want that pain to go away. Essentially, they give that prescription of Narcan with it so that you have that on hand, because accidental overdoses happen all the time.
Yeah. So Narcan is actually stronger than the opioid. It physically knocks them off the brain's receptor and takes their place. It kind of shows that in the picture we have on the slide. By kicking the opioids off, it unmutes the brain. Usually the person will wake up and start breathing instantly. Now, one thing about Narcan is people don't like withdrawal symptoms. So if somebody's in an overdose, you give Narcan, they're not going to be very happy when they wake up. So you do have to be careful giving Narcan, but always, if you're in doubt, like I said earlier, always administer it.
And we talked earlier in the first session, it's been given to babies, it's been given to animals. It's not going to hurt you. And if you don't know what they've overdosed on, if they've overdosed on like a Xanax or a Valium or something like that for anxiety, the end goal is to give it to them because it's not going to hurt them no matter what they have taken.
Yeah. Like she just said, Narcan only works on opioids like heroin, oxy, fentanyl. It won't do anything for alcohol, coke, or benzos like the Xanax we saw earlier, the little bar. We've mentioned this already, but we want to emphasize that if you aren't sure if they have overdosed on an opioid or not, it is always better to use Narcan than not to, because it will not harm the person in any way, and it's not addictive. Narcan is a blank key. It fits into the lock or the receptor, but it doesn't turn it. It has zero effect on its own. You can't get high off of Narcan, and it isn't addictive. Nobody abuses Narcan. It's safe for everyone, babies, seniors, even your dog if they accidentally eat something they shouldn't. If you use it on someone who's just having a heart attack or a different medical issue, it won't hurt them. When in doubt, use it. Someone who has been revived with naloxone should not be left alone. In case the naloxone wears off, which could cause another overdose, even if naloxone is administered, the person must see a licensed medical professional. People who are revived from an overdose are often not grateful. Naloxone will put them into an overdose withdrawal if the person is a regular opioid user. Opioid withdrawal is very painful. There will be there will be abdominal pain, and the person can experience nausea, vomiting, and diarrhea. If the person is a regular opioid user, withdrawal is also experienced if they are unable to get the drug in 8 to 24 hours. 8 to 24 hours is nothing. If you can only go 8 to 24 hours without like drinking something, taking something, that is a miserable life. So that's just another emphasis. Like, I don't recommend taking stuff off the streets, guys. But we're gonna take a minute to discuss this question. When should you call 911 if you think someone is overdosing?
Anybody? Immediately.
Yes.
Absolutely. I know that seems like it's fast.
No, I mean,
Immediately
it seems
call.
obvious, but I mean, very important to remember. And what do you do after you call 911? What do you do while you're waiting for them?
Thank you.
Exactly. Is it just me? Okay. So some resources for harm and reduction strategies. Since addiction rewires the brain, we treat it like any other disease, like diabetes or asthma. It's a medical problem that needs a medical solution. We use specific medicines like methadone or buprenorphine.
Buprenorphine. How many
Yes.
of you have heard of Suboxone? If you've ever heard of Suboxone, that is the brand name of buprenorphine. And what this drug does is it helps patients that are trying to come off of opioids. It helps them have that, kind of like that receptor that you saw. It blocks it in the brain. It says, hey, I'm not letting you in. So patients that are on Suboxone have to have a urine test. Urine test every time they pick up a prescription to show that they do not have opioids in their body. Because what will happen if you're taking Suboxone but you've then taken opioid? Anybody know? I take that first oxycodone. I'm taking my Suboxone. That receptor in my brain stops it. I get no high. I take that second one. The receptor stops it. At that point, I'm still not high, but I'm looking for that high. I take that third one. At that point, I could have overdosed if my tolerance, depending on where my tolerance is. So with that overdose, that is pretty much, we're not doing it intentionally, but pretty much that's how it happens.
Yeah. It stabilizes the brain. These help to stop the freak out or withdrawal, and cravings so that people can focus on getting better and not just their addiction. Medicine fixes the physical part, while therapy can fix the mental part. People with drug dependency usually need both to succeed. Recovery isn't a straight line. For some, it's medicine. For others, it's support groups or counseling. There's no right way, only the way that keeps the person alive and healthy. So some harm reduction strategies, as you can see on the screen, it would be avoid random pills. Don't take pills on the street. Take pain medication exactly as prescribed. The person who wrote your label on your pill bottle, guess what? They probably went to school for at least 8 years if it was a PA, and then probably 12, 16 years if it was a doctor. So take it exactly how it's written on the bottle. Know the risks and stay educated. So before you take that opioid, maybe do a quick research. Know what happens to your body before you take that drug. And then promote safer use strategies. Then.
Okay, pull out your Chromebooks. There's an 8-question. It's going to populate your names. Do not type names in. It's going to generate your own little name.